How does MRI imaging detect lung cancer? Imagine a tool that can see inside your body without using harmful radiation. Magnetic resonance imaging, or MRI, does just that by using strong magnetic fields and radio waves to produce detailed images of your lungs. Unlike X-ray-based scans, MRI relies on the properties of tissues themselves, such as water content and blood flow, to create contrast. This makes it especially useful for distinguishing between different types of tissue and identifying abnormalities. When it comes to lung cancer, MRI can detect small lung nodules, which are tiny masses that may be early signs of cancer. Under optimal conditions, MRI can identify nodules as small as 3 to 4 millimeters with high sensitivity. Nodules larger than 5 millimeters are detected almost all the time, making MRI a helpful tool for spotting suspicious lesions that could be early lung cancers. MRI also helps characterize these lesions by evaluating their internal structure and blood supply. Using special imaging sequences and sometimes contrast agents, MRI can assess how a nodule takes up and releases contrast material. Malignant tumors often have different blood flow patterns compared to benign nodules, so this information helps doctors determine whether a lesion is likely to be cancerous. Recent technological advances have improved MRI's ability to image the lungs. High-performance gradient systems, phased array coils, parallel imaging, and compressed sensing techniques have increased speed and image clarity. These improvements help overcome challenges like breathing motion and the low proton density of lung tissue, making MRI more effective in lung imaging. MRI is also valuable for staging lung cancer. It can show whether the tumor has invaded nearby structures such as the chest wall, blood vessels, or the mediastinum. Because MRI provides excellent soft tissue contrast, it helps doctors understand how far the cancer has spread beyond the lung itself. One of the key benefits of MRI is that it does not expose patients to ionizing radiation. This makes it a good choice for people who need multiple scans over time or for those who are sensitive to radiation exposure. While computed tomography scans are still the primary tool for detecting small lung nodules because of their higher spatial resolution, MRI is gaining recognition as a complementary method. It is especially useful for detailed lesion characterization and assessing the extent of disease. As MRI technology continues to improve, including molecular imaging techniques, it holds promise for earlier detection and more precise diagnosis of lung cancer. In summary, MRI detects lung cancer by producing detailed images that reveal the size, structure, blood flow, and invasion of lung tumors. It supports diagnosis and helps plan treatment, all while avoiding radiation. However, it is typically used alongside other imaging tests like CT scans to give a complete picture of lung health. Always remember to consult healthcare professionals for personalized advice and diagnosis.